Back pain is one of the most common reasons people seek medical help or miss work. Back pain is a leading cause of disability worldwide. Fortunately, measures can help prevent or relieve most back pain episodes, especially for people younger than 60 years. To discuss about back pain, slip disc, its symptoms, treatments and diagnosis, we are joined by Dr. Bipin S. Walia, Principal Director and Head Neurosurgery at Max Super Specialty Hospital, Saket. Doctor, we welcome you on this edition of Max Doctor.
Thank you. Back pain is extremely common. You'll be surprised to know that 90% of humanity would suffer from back pain during some stage in their lifetime. It occurs as a child grows up. It occurs in women who are pregnant. It occurs in the elderly as a part of degenerative process that happens to all of us. It's a very common problem, and we should be aware of it and should be prepared for it.
And when we talk about the causes of back pain, what are the common causes of back pain?
It's a multifactorial problem. It's not so simple. From anything from bad posture, injury to the back, vitamin D deficiency, slip disc, it's a whole lot. But the commonest problem that we see is the commonest cause that is there is because of people having a bad posture, poor muscle tone. And this occurs in the current environment. We sit for hours on a laptop, we sit for hours on a desk at work. The desk may not be ergonomic. We come home, we sit on a bed, watch TV for hours on end. No physical activity, poor muscle tone. That is the commonest cause of back pain today.
Now, when talking about treatment protocol, how is back pain treated?
So here I would like to correct a misconception that people have. The vast majority of patients do not require surgery. Back pain in the vast majority would require a correct diagnosis, analysis of the situation, and then the management. The management in majority of the cases requires just physiotherapy, a mild muscle relaxant for a short duration, correction of the posture, and then exercises to strengthen the back muscles and correct the alignment.
Another commonly asked question is about slip disc. What are the common symptoms of a slip disc?
Well, first I would like to tell you what a slip disc is. A disc in the spine is a soft piece of tissue which exists between two hard bones called the vertebrae. Occasionally, because of injury, bad posture, or lifting heavy weights, there may be a tear in the ligament and a piece of this disc bulges out backwards, either pressing the spinal cord or one of the nerves. The symptoms can be back pain, or it can be leg pain, or what we call sciatica, which is typically a pain going down the side or the back of the thigh up to the calf or the ankle. It can be associated with numbness or pins and needles, and rarely with weakness of the foot.
When you talk about slip disc, what is the treatment of a slip disc?
So, a common wrong concept that people have that all slip discs require surgery. They all require prolonged bed rest. Both are wrong. The vast majority, more than 90% of slip discs are managed conservatively. Conservative means a short duration of bed rest, less than 2 to 3 days, physiotherapy, medication, and back strengthening exercises. We advise surgery only in cases of if a person comes with acute agonizing pain, or if he is getting weakness of the foot or the leg, or is having difficulty in passing urine. Rarely, if a person has been having conservative treatment for more than 3 to 4 months and he has some good days or some bad days, then after trying non-surgical treatment, we are talking about medical treatment for a period of 12 weeks, surgery can be offered to the patient. Because some patients say, look, this now interfering with the quality of life. And if he wants an improvement in that quality of life, surgery is an option. I would also like to add one more thing. Slip disc surgery is very safe. It's minimally invasive. The hospital stay is just 1 day and people can be back to work in less than a week and back to active games, including working out in gyms, games, whatever they want to, in 4 weeks.
Doctor, you talked about the quality of life. What would be some healthy tips you would like to advise to our viewers?
Most important, a healthy diet, a balanced diet, number 1. Number 2, get adequate amount of sunshine, because vitamin D is made in our skin by exposure to sunlight. Number 3, spend some time on your body. Either go for a walk, exercise, workout, whatever suits you, whatever makes you happy, but you must spend some time in your body. Number 4, correct your posture. Make sure that your work desk or your workplace is ergonomic and suited to your back.
And before we conclude this session, what would you advise our listeners?
The single point that I want to say is, if you get back pain, don't panic. It is something that is very common, easily treatable, and you can continue to have a good, healthy life without any major restrictions for the rest of your life.
Doctor, we thank you for joining us for this enriching session. If you have a question, suggestion or feedback, please drop us a comment below and follow us on Facebook, Twitter, Instagram, LinkedIn and YouTube.